For my database analysis project, I decided to focus on the obesity prevalence in young adults into adulthood. A lot of the information that we find out there focuses mostly on providing information about children who are obese or are overweight, or adults who are obese and overweight, and the consequences and the risk factors associated with those two different populations. However, for my project, I wanted to see the relationship between those two groups and how one prevalence or one group of people led to a higher prevalence of the same issue as an adult, and if there is a relationship to be discussed. So, does obese children or young adults have a higher prevalence of being obese adults or overweight adults? The objective of this research project as well was to determine if there is a relationship. Could we determine a intervention program or a program that will help the different populations early on or at a specific point in life, rather than presenting this information when it might be a little bit too late. Obesity is the second leading cause of preventable disease in the US, and it's the fact that it can be preventable and yet it's a leading cause of death. It's a pretty significant statistic, and makes you realize how little we are actually able to do or have done so far in order to reduce this number. Between 2009 and 2010, 60% of the adult population was overweight or obese. That's a really high number. And again, it brings to question what type of programs are out there that are actually helping prevent for this increase. What is out there or what is not out there, or if there is something out there, is the information not getting to them on time, to people on time? In order to be able to find this information, I looked at the CDC behavioral risk factors data for both adults and youth, and then I also went into the data sources for the Institute for Health Metrics and Evaluation. Both of these sets provided different type of information that helped me find the relationship and answer the question that I'm trying to answer. Especially the Institute for Health Metrics and Evaluation provided a plethora of data where it compared age, minorities, race, ethnicity, socioeconomic status, education, and compare them between male and female, and the prevalence between those two groups and the different factors that could influence somebody from being obese or overweight. And during this time, I also discovered that 16.9% of obesity prevalence among children and young adults, 16.9, that's close to 20% of young adults have a high prevalence of obesity. And again, that 16.9% is that part of the 60% that eventually become adults. And obesity prevalence affects minorities just as well as any other group. And interestingly, there seems to be a higher prevalence among non-minorities. And so the data that I was able to find provided a lot of information, a lot of background, and a lot of correlation between the two different groups. Also, the data that I found had 4 different very clear characteristics. One, all the data that I was able to find, which were different sets, up to 4, I believe, that I found, where it was clear and accurate, and it was readily available to me. There were a couple of times that I had to go back and find it, and there was no problem in finding it. And it also, it was appropriate to the readers. I was able to understand the data, the percentages, the prevalence. I did have to clean it up a couple of times. I did have to figure out what it meant by prevalence, and then able to determine between the female and male rate and how they differentiated, and how it changed between 2008 and 2009. But overall, the data was pretty clear and concise, and I know that people that have better backgrounds and have more research experience could probably find a better correlation between the data sets. And I was able to do clean up most of it on my own, or actually I did clean up most of my own and be able to find a correlation between one group and another one. Interestingly and not shockingly, both of the organizations, even though one focused more, the information from CDC focused more on nutrition, physical activity, and obesity, while the health metrics data focused more on obesity, overall obesity prevalence, and there had some information on physical activity between male and female and how to differentiate between age and groups of people. They provided different results, and combining that information was helpful in order to be able to have the findings and be able to find the information that I needed. But even though the data was different, I think both organizations were trying to provide this information in order for groups and community members be able to see it and understand it and see what the trends are over time and be able to correlate one with the other one, where obese children will have a more higher prevalence of being obese adults or overweight adults. So they both collected information that had the same goal and then the same goal in mind, and be able to provide the same outcomes even though they were two different organizations. And I think both data also were used to try to develop intervention programs and programs that are or could be effective in comparison to what we could possibly have that may not be as effective. So the data definitely is meant to be used to further develop programs, to further develop interactions and correlations, and present this information to those that affect our lifestyle and our health. There are many people in our lives and in the lives of those who tend to be overweight or obese that affect their daily life, their nutrition, their health. And so throughout this research, I decided to focus on 4 different types of target population: children, young adults, adults, and minorities. I started out with just minorities, but I realized that there's more information out there, and in order just to start a broad research and data analysis, I mostly focused with children, young adults, and adults, and I think minorities have to be their own separate database analysis in order to obtain more information. And so looking at this target population, we look at the different stakeholders that influence how children become more healthy, how children can become overweight, and how that translates into adulthood and into our jobs, into and how even the government, health policies, health centers influence the community at large and each individual. And from those stakeholders, I think we can divide them into main categories. And for me, I think it would be policy, government, healthcare, community, and resources. Policy obviously influences a lot of parts of our community: healthcare center, health professionals, health education out there, public health in general. Same thing, government greatly influences the resources that are available to the different people, to the different populations. Healthcare, not everyone is able to access healthcare. And if you're not able to access healthcare, which could be anywhere between a doctor or a nutritionist or any type of health resource, then you might not have the information that you may need. And community, again, a major component of our daily lives, and that includes family members, school, community centers, a lot of different components to community that can influence the way we eat, the way that we behave, our physical activity levels, and then also the resources that are available to us. Again, if policy affects different things and government limits the amount of funding, well, there may be less resources, less health education to people. less information about how to take care of yourself, how to eat healthier, and most of these resources tend to be at a low cost or free. And if those funds are not available, or if the resources are cut, then what is going to happen? Where are people supposed to get the information they need? And sometimes even if the information is there, because of culture or language, we might not be able to provide the necessary information. So stakeholders are a huge component to the way people grow and either are able to maintain a healthy lifestyle or have a higher prevalence of obesity as adults. And as you can see here in this influence diagram, they all connect into one thing, and they all somehow end up influencing each other. So healthcare certainly affects health professionals, which is affected by public health. Culture and language is a huge impact in our daily lives, and for people, if the resources are not available in the right language or with the right information, they might not be able to get across. Schools may be a great place for prevention programs, intervention programs to be implemented and help children understand them, and they can share with their family members, who in turn will also be able to help them. So there is a lot of stakeholders that contribute to the overall overweight, obesity population and the prevalence into adulthood. And they all each have their own components. The goal here is for all of them to work together and be able to provide the different resources in order for these people to have the information they need and successfully have a healthy lifestyle. If those resources don't come together, those stakeholders don't come together, then it might be a little bit more difficult to continue having a healthy lifestyle. So there are different components that need to be targeted in order to decrease the prevalence of obesity among young adults and adults. Of course, unfortunately, we're not always able to work together, and we're not always able to provide the resource that we need to those people. And because of that, I was able to find information that indicated that because of the lack of resources, as young adults and as children do lead to higher prevalence of obesity in adulthood. So as we can see that here from this infographics, early overweight development leads to an obese adulthood, and adult prevalence of obesity in 2014 increased to 36%. Interestingly enough, the people that have a higher prevalence of obesity are those in the middle age. If you were considered overweight or obese as a child, then your prevalence of being overweight and obese as an adult, middle-aged adult, actually increases as well. And so that prevalence is anywhere between 40.2% to 37% in comparison to 32% in young adults. And then if you look at the physical activity and obesity prevalence in males and females, they tend to be about equal. However, males tend to have a higher prevalence in obesity. And all the information also points that only 14% of 13 to 19-year-olds cease to be obese as young adults, which is the age between 16 and 20 years old, which means only 14% of young adults actually overcome being overweight or obese. And unfortunately, the upward trend of obesity, in fact, indicates the need for preventative strategies in order to curb this growth. So in summary, I was able to find the data and relationships here that there is an association between young adult obesity and adult obesity that can be preventable. And as we saw, 14% of women have a higher obesity prevalence than men, and minorities are equally affected as adults. within obesity prevalence. This information can be used to develop prevention programs that should focus towards a younger population before they reach adulthood.